Welcome to the deep dive. Today we're tackling a really important topic, men's sexual and hormonal health.
Yeah, it's a big one.
We've gone through this great conversation with Dr. Reena Malik. She's a urologist from the Checkup podcast.
Really knowledgeable.
Absolutely. So our goal here is basically to pull out the most, crucial bits, the surprising stuff, to help you make sense of it all. It can get pretty overwhelming.
Totally. And what really jumped out at me right away was what Dr. Malik said about online discussions.
Oh, the lack of nuance.
Exactly. Like everything's black or white, porn's all bad, or tea is the magic bullet, all these extreme views.
Right. No middle ground.
And she sees the fallout, Patients coming in, misled by stuff they read online, real consequences.
Yeah, that sets the scene perfectly for our first point, really. The whole issue with unregulated supplements. Dr. Malik was saying how many guys are taking this stuff based on, well, hearsay, or online hype.
With no real idea what's actually in them. Or the risks.
And the regulation, or lack of it. The FDA, she said, they mostly react after something bad happens.
Yeah, they're not proactively checking most of this stuff. They wait for the harm reports to pile up.
Which is kind of scary when you think about those, gas station sex pills.
Oh, yeah, those.
Dr. Malik pointed out they often have hidden drugs in them, like the actual ingredients in Viagra or Cialis.
Tadalafil, sildenafil.
Yeah.
But you don't know the dose. It's completely unregulated.
And the biggest worry there...
Interactions, right.
That's the major concern, especially with heart medications, cardiovascular drugs.
Because the guys using these might be older, maybe already have heart issues.
Exactly. Higher cardiovascular risk profile. It's a dangerous mix.
Definitely a wake-up call.
Okay.
So shifting gears slightly, Dr. Malik talked about erectile dysfunction as like an early warning sign.
Yeah, like a canary in the coal mine. That's how she put it.
For what, exactly?
For underlying cardiovascular problems. Vascular disease problems with blood flow is the #1 cause of ED.
#1. Wow. And get this statistic she shared. Within 7 years of developing ED, 15% of men will have a heart attack.
15%. That's significant.
It really is. Those tiny blood vessels in the penis are often the first place broader circulatory problems show up.
Which just hammers home the danger of, grabbing those supplements or getting ED meds online without a proper checkup.
Absolutely. Especially, she mentioned, if someone's taking nitroglycerin for chest pain. Mixing that with ED meds, even prescription ones obtained without proper oversight, can cause a massive, dangerous drop in blood pressure.
Okay, so that naturally leads into the whole online prescription service thing.
Right. They offer access, which is good in some ways.
But Dr. Malik had concerns, like self-diagnosis, super quick virtual chats, maybe not getting the full picture.
Yeah, are they really reviewing the patient's full history properly? It raises questions.
Because even though drugs like sildenafil are pretty safe for a lot of guys...
They're not for everyone, like the nitrate users we just mentioned. That's a major contraindication.
And the bigger worry is maybe missing the chance to say, hey, you should see your primary doctor, maybe a cardiologist.
Exactly. To find the root cause. Is it a vascular issue? That needs proper attention.
It's this weird split Dr. Malik talked about, isn't it? Like too much screening on one hand and just give me the pill on the other.
Yeah, both extremes missing the nuance, the individual person's health.
Right, and we need that bigger picture perspective. She stressed that even guys who look healthy, who exercise...
They can still have ED because of underlying stuff like high cholesterol that they don't even know about.
So the quick fixes, the pills, they don't solve that underlying problem.
Not at all. And getting patients to buy into lifestyle changes, that's the real challenge.
Especially with bad info online, like cholesterol doesn't matter.
Right. It makes that conversation so much harder for doctors trying to promote actual health changes.
Okay, let's pivot to another huge topic, low testosterone. Everyone's talking about it. What did Dr. Malik say?
Well, first off, she confirmed it. We are seeing more low T now than decades ago.
Okay, why?
Several reasons. More comorbid conditions, think diabetes, high cholesterol, high blood pressure. They're linked.
Makes sense.
Also, just age-related decline in how sensitive the body is to the testosterone it does have. The receptors aren't as responsive.
What about those endocrine-disrupting chemicals? We hear a lot about plastics and stuff.
She mentioned them, yeah.
Yeah.
But cautioned against making them the main focus. They're kind of everywhere. It's hard to avoid completely.
Right. Probably not the biggest thing we can actually change.
Exactly. She kind of joked about it being in everything. The bigger modifiable factors she stressed were things like poor sleep.
Sleep. Always comes back to sleep.
Lack of the right kind of exercise, specifically resistance training, big muscle groups, and HIIT.
Okay, resistance and high intensity.
And chronic stress. That's a big one.
What about other theories, like evolutionary stuff or IVF?
She touched on them briefly, but didn't think they were major drivers compared to lifestyle factors.
So bottom line, for boosting T naturally, prioritize sleep 7 to 9 hours.
Good quality sleep, yeah.
Hit the weights, focus on big muscle groups, maybe twice a week, plus some HIIT.
That's what the evidence points to.
And manage stress, because chronic stress jacks up cortisol.
Which pushes testosterone down. So yeah, stress reduction techniques are important.
It really sounds like her overall message was, what's good for your heart and brain?
It's generally good for your hormones and sexual health, too. It's all connected.
Okay.
Yeah.
Now, the supplements. The testosterone boosters, what's the real deal there?
Not much of a deal, according to Dr. Malik's evidence-based take.
Okay. Minimal data.
Very minimal for most of them. And she explained why we're unlikely to see big, high-quality studies.
No money in it for the companies.
Pretty much. They can sell it without proving it works rigorously, so why spend millions on trials?
What about specific ones like Tongkat Ali? That one comes up a lot.
She said there's some data, but it's often not enough to make a real, noticeable difference. Plus, people take it while changing their lifestyle.
So you can't tell what's doing what.
Exactly. It's confounded.
And Phaedogia agrestis.
Zero human data, period. Just studies in rats and mice.
Wow.
Yeah, she expressed concern about, health gurus promoting supplements with no human evidence. Personal anecdotes aren't proof.
Kind of like the goop effect she mentioned. Marketing based on, it worked for me.
Right. Even with caveats, it drives sales. And you have to wonder about the financial incentives behind some recommendations.
Her point was, if this stuff really worked well and was safe...
Doctors would be all over it. It would be part of standard medical practice.
Which leads us neatly into actual testosterone replacement therapy, TRT.
A topic with a lot of noise around it.
She said it's been kind of hijacked.
Yeah, by unqualified fitness influencers, often.
Yeah.
Leading to more guys asking for it, sometimes just for fatigue, even with normal T levels.
And using it off-label just for muscle building.
That's recreational use, she stressed. And it's not safe. It carries real risks.
So when is TRT appropriate?
For men with confirmed low testosterone and significant symptoms affecting things like mood, libido, erections, muscle mass, energy, brain fog.
But not just for ED.
Rarely just for ED. Hormones only cause maybe 3–6% of erectile dysfunction cases. It's usually vascular.
Okay. So TRT might help nocturnal erections, but maybe not fix the main ED issue itself.
Correct. It's not usually the primary solution for ED alone.
She also mentioned an overlap. Younger guys, mental health issues, asking for TRT.
Yeah, it's an interesting observation. Sometimes anxiety or depression symptoms mimic low T symptoms.
And the irony of guys wary of big pharma ads falling for sexual health marketing.
Right. It's a strange paradox. But importantly, she said routine screening for low T in guys without symptoms isn't recommended.
Okay, but if someone does have symptoms, what are the key ones to look for diagnostically?
Low sex drive is a big one. Depression or mood changes, that brain fog feeling.
Yeah.
And sometimes ED.
And diagnosing it properly, she mentioned morning tests.
Yes, 2 separate blood tests early morning because levels fluctuate highest AM.
Need 2 checks to confirm.
Right. And you worried about some hormone clinics, maybe jumping the gun.
Not checking levels properly or prescribing without good follow-up.
Exactly. She cited a secret shopper study where people with normal T got prescribed TRT.
Seriously, without discussing side effects.
Yeah, like stroke, blood clots, and no clear plan for monitoring, which is crucial.
What needs monitoring on TRT?
Hematocrit blood thickness, PSA prostate marker,
Yeah.
and testosterone levels themselves, obviously. And maybe lipids or liver function, depending on the type of TRT.
And going back to the diagnosis, that morning test is key because T levels drop during the day, right?
Yeah, test late in the day, you might get a falsely low reading. Need those 2 morning checks for accuracy.
Another huge point she made, infertility risk.
Massive risk, especially long-term. Most men become infertile within about 18 months on TRT.
So young guys wanting kids need to really understand this.
Absolutely a critical conversation to have with their doctor.
So summing up TRT risk benefits, if you have confirmed low T and symptoms, benefits can outweigh risks.
With proper monitoring, yes.
But if your levels are normal, risks go way up, benefits are questionable.
Definitely. And using super high, super physiological doses, even riskier.
Why? Don't higher doses mean more benefit?
Not necessarily for standard TRT goals. The receptors get saturated. Higher doses are usually for muscle gain like anabolic steroids.
And the risks mirror steroid risks: liver, kidney, heart problems.
Yeah, potential for liver failure, renal failure, heart hypertrophy, arrhythmias, heart attacks. Scary stuff. Slight bumps above normal with prescribed TRT are probably okay occasionally, but sustained high levels are the danger zone.
Okay, tricky question. What if total T is normal, but someone has symptoms and high SHBG?
Ah, yes, sex hormone binding globulin. It binds testosterone.
Makes it unavailable.
Right. So maybe 45% is bound up.
Yeah.
If your SHBG is naturally high, your free usable testosterone might be low, even if total T looks okay.
So those guys might benefit from TRT.
Might. It requires careful interpretation of the labs. It's nuanced.
But if total T, free T, and SHBG are all normal and you still have symptoms,
TRT is unlikely the answer. Need to look for other causes, check other hormones like prolactin.
which checks should be done before starting TRT anyway?
Prolactin, LH, FSH, estradiol, and definitely PSA. Rule out other stuff first.
Let's talk PSA. Does TRT cause prostate cancer?
No, it does not cause it, but it can make existing prostate cancer grow faster.
Which is why you check PSA beforehand.
Got it.
Got it.
Crucial step.
What about side effects like hair loss or BPH symptoms?
Male pattern baldness. It might speed it up if you're genetically prone. Not guaranteed, though.
And BPH, enlarged prostate symptoms.
Good news there. Recent high-quality studies, like the Traverse trial, show TRT doesn't worsen urinary symptoms in men with low T.
That's a change from older thinking.
It is. But those super high non-physiological doses might worsen symptoms because more T converts to DHT.
What about older guys, 65 plus I, low T on labs but no symptoms? Treat or no?
Controversial. Some hints of metabolic benefits maybe, but if they feel fine, healthy, why treat?
Treat the person, not the number.
Exactly. Shared decision-making is key if it's found incidentally. Screening isn't recommended without symptoms in this group either.
Does TRT make guys take more risks or get injured more?
Probably more linked to the super high doses, the steroid use territory. Not a big concern with normal TRT levels. Might even improve quality of life and activity for some.
Okay, let's bust some myths Dr. Malik mentioned. Semen retention, no nut November. Does that boost T?
Nope. No real evidence. One tiny study showed a clinically insignificant blip after 21 days.
And forced abstinence can cause problems? Pelvic floor tension.
Yeah, but potentially leading to ED, pain, urinary issues. Plus, nocturnal emissions are normal, not failure.
Right. Okay, clarifying cardiovascular risk again. High doses equal bad. Normal TRT levels in men with low T.
Do not seem to increase cardiovascular risk based on good recent data like Traverse. Stroke, blood clot risk also appears low with proper management.
But still need to monitor cholesterol hematocrit.
Absolutely. Standard monitoring is still important.
And the fertility risk, just to hammer it home, that risk is there whether TRT is used appropriately or not, right?
Correct. Anyone considering TRT needs that fertility discussion. Options exist like baseline semen analysis, maybe using HCG.
But TRT is definitely not male birth control.
Absolutely not. Big misconception.
Okay, switching to premature ejaculation strategies, edging.
Can be helpful. The stop-start technique. Done correctly, not excessively.
What about stopping pee midstream?
Useful only for learning where your Kegel muscles are. Don't do it regularly, bad for bladder function.
And Kegels for men, good for
Strengthening the pelvic floor. Great after prostate surgery for leakage. Maybe helps orgasm control. But overdoing them can cause pelvic floor dysfunction, tightness.
Gotcha. And wet dreams, nocturnal emissions, totally normal.
Completely normal. Body's way of maintaining things, reflex, nothing to be ashamed of.
Pelvic floor dysfunction in men? Underdiagnosed?
Very much so. Things like sitting too long can cause tension. Needs a proper exam, often internal.
And basic urinary habits matter, like not straining.
Yes. Avoid straining, avoid stop-and-go peeing. Sitting to pee can actually help some men, especially with BPH.
Speaking of BPH, how to prevent it?
Manage inflammation, control diabetes, other conditions. Aerobic exercise helps 150 mins a week.
Diet, lycopene.
May be beneficial. Tomatoes, watermelon. But mainly, see a doc if you have urinary trouble.
What about supplements for BPH? Saw palmetto.
Studied extensively. No significant benefit shown over placebo.
Others like stinging nettle.
Same story. Lack of evidence. Placebo effect is likely strong here.
Okay, let's clarify what TRT is not proven to help with.
Right. It won't magically fix erections for most guys, only that small subset with hormonal ED.
Won't give you huge muscles without working out.
Definitely not.
Won't make you generically more masculine.
Nope.
won't increase penis size, length, or girth.
Zero evidence for that. It's just not a magic fix-all.
And the quality of life boost isn't guaranteed.
Varies hugely. Some guys don't feel much different. Some don't like the side effects, gyno, acne, nervousness, aggression. It happens.
What about that 21 ejaculations a month thing for prostate health? Myth or...
Based on one study showing lower prostate cancer risk in high-frequency ejaculators compared to low.
Why the prostate stagnation idea? Clearing stuff out.
That's one theory. It's interesting data, but Dr. Malik stressed it's not like a prescription. Don't feel obligated. Not harmful, but not a mandate.
Okay. Penis size concerns. Big topic. Dr. Malik's approach.
First, understand the why. Partner issues, personal anxiety, body image.
Because there's no safe, effective, lasting surgical fix for length.
Basically, no. For small penis anxiety, it needs mental health support, a multidisciplinary approach.
What about non-surgical stuff? Weight loss, shaving.
Those can change perception, yeah. Reducing anxiety can help too, as tension can cause temporary shortening.
Traction devices.
Some data showing maybe a couple centimeters gain with consistent prolonged use. Hours daily, initially. Long-term maintenance is unclear.
But surgery. Risky.
Very risky.
Ah.
Severe consequences, side effects like sensation loss, scarring, not widely offered by reputable surgeons for just cosmetic reasons.
The pneuma implant.
FDA approved, yes. But Dr. Malik noted urologists see significant problems removal, scarring. Be super wary of providers only showing positive outcomes.
Okay, back to ED. Number one cause again.
Vascular dysfunction in middle-aged and older men. Blood flow issues?
But psych factors always play a role. Performance anxiety.
Always. Especially primary cause in younger guys, often. That vicious cycle. It's linked to high blood pressure, cholesterol, diabetes affecting those small arteries.
What about fear of side effects from ED meds?
Priapism, that super long erection. Extremely rare with the pills like Viagra, Cialis, used correctly. More concerned with injections.
And if it happens.
Sudafed might help early on at home. But if it lasts over 4 hours, it's an ER visit to prevent damage.
Can guys get dependent on ED meds?
Psychologically, perhaps? Dr. Malik mentioned using low-dose daily tadalafil strategically in young men with psychogenic ED.
To build confidence alongside therapy.
Exactly. Recreational use happens too, like for gym pumps, but that's less clear medically.
And tadalafil Cialis is also used for BPH.
Yes, the 5 milligram daily dose helps relax the prostate, improve urinary symptoms. Good combo for men with both ED and BPH.
What if pills don't work for ED? Other options?
Intraurethral suppositories, MUSC. Often not much better than pills, though.
Yeah.
Vacuum erection devices. Effective one-time cost, but takes learning, different sensation.
And injections.
Intracavernosal injections. Very effective, maybe 80%, quicker onset. But yeah, injecting your penis. Risk of priapism if dose is wrong.
Can we quickly touch on the physiology, point and shoot?
Yeah. Pro-erection. Parasympathetic nervous system. Relax and fill.
Yeah.
Shoot, ejaculation. Sympathetic, fight or flight.
So nerves interfere with the point part.
Right. Sympathetic activation blocks parasympathetic.
And overexcitement triggers the shoot part too early.
Can do, yeah. Premature sympathetic activation.
So non-drug approaches for premature ejaculation. HIIT training.
One small study showed promise.
Yeah.
7 minutes daily for 2 weeks. Maybe balances nervous system, body awareness.
Mindfulness.
Meditation. Helps women with low desire. Likely helps men too. Increases presence, reduces anxiety. Thinking of sex as play helps lower pressure.
And breathing. Seems simple, but...
Crucial. Diaphragmatic breathing relaxes the pelvic floor, which is involved in orgasm. Focusing on breath helps manage that sympathetic, parasympathetic
For
balance.
communication too, right? Just talking about it.
Huge. Asking, what are you into? Reduces anxiety, improves the experience for everyone.
Okay, obsession with semen volume. Why?
Often driven by porn, which might use tricks to enhance visuals. Some guys just find more volume more pleasurable.
Does it decrease with age?
Can do.
Yeah.
Weaker pelvic floor muscles mean less projection force. Volume also varies day-to-day hydration, frequency of ejaculation.
Clinically only matters for fertility.
Pretty much. Hydration helps.
Yeah.
Ejaculating less often increases volume temporarily. No magic pills or supplements work reliably.
The pineapple question. Does it change the taste?
High fructose foods might increase sweetness over time, consistently. Pineapple is high sugar.
So not an instant fix.
No. Generally, healthy lifestyle, fine taste.
Oh.
Hydration, good diet, no smoking, less caffeine.
If a partner notices a change...
Check diet, hydration. Blood in semen needs a doctor check, usually benign. Other colors usually okay. STIs could maybe alter taste, so check if concerned.
Okay, last big area. Prostate cancer screening. PSA test. Where do things stand?
Dr. Malik called it a rocky road. Debate still exists. USPSTF recommends shared decision-making.
So patient and doctor decide together.
Exactly. For an average guy, 45, 50-ish.
Yeah.
Depends on risk factors, family history, race, African-American, higher risk. Getting a baseline might be reasonable, higher risk. Screen earlier.
Why shared decision-making? Because treatment has downsides.
Big downsides, potentially. ED, incontinence. Many prostate cancers are slow-growing, don't need treatment. Treatment regret is real. Biopsies have risks, too.
What about older men, 75 plus spleen? Screen them.
Depends on life expectancy, overall health. If limited, probably not beneficial. Would they even want treatment if found? Screening causes anxiety. Tests have risks.
But PSA screening has been valuable historically.
Well, yeah. Before PSA, guys often showed up with metastatic cancer, bone pain. PSA helps catch it much earlier, avoid that stage.
What about the DRE, the digital rectal exam?
Controversial as a screening tool alone. Useful for urologists assessing size, other issues, especially with urinary symptoms, LUTS.
But if no symptoms and PCP isn't trained comfortable?
PSA is primary. It finds most cancers. DRE alone finds only about 3% not caught by PSA. And the palpable area isn't where most cancers start.
If PSA is high, doesn't automatically mean cancer.
Right. Could be BPH, inflammation, recent catheter. AP tests often needed.
Prostate MRI, that's newer.
Big advancement. Helps identify suspicious spots, guides biopsies much better.
Biopsy risks, small but real.
Yeah, 1–2% risk of serious infection, bleeding, discomfort.
And then if cancer is found, what next? Watchful waiting.
That's a crucial part of the shared decision-making. Watchful waiting or active surveillance is increasingly used for lower-risk cancers.
So the goal is balancing finding significant cancer without overtreating or causing harm from the process itself.
Exactly. Prevent the bad outcomes without causing unnecessary problems along the way.
Wow. Okay, so bringing it all together, we've hit on needing nuance, the dangers of unregulated supplements,
The ED-heart connection, the realities of low T and TRT.
lifestyle being key, and getting a balanced view on screening like PSA.
It's a lot, but hopefully clarifying some key points.
Definitely. And maybe a final thought for listeners to chew on.
Yeah, maybe consider. Are there aspects of your own sexual or hormonal health you've just accepted as normal without really looking into them?
Good question.
Could making some small evidence-based changes actually lead to surprising improvements in how you feel, how you understand your body?
Something to think about. And on that note, we'd love to hear from you all. Any other topics, maybe ones that feel a bit awkward or aren't talked about enough that you're curious about?
Let us know. We might dive into them next time.